Okay, so I am recording this. So just wanted to again to say thank you to all of the students, and I think that actually might be her. There she is. Um, to all of the students for all of your really hard work this quarter. We really appreciate everything that you bring to our program, and hope that you found the same on your end. Huge shout out to Andrew and Heather for all of their just super hard work in making the program go well year over year. And then to Juan as well for setting up the survey piece of this. So really appreciate his work on that. And I think you've met everyone, maybe not Michael. I introduced V, but Michael is our director of donor experience. Is that right, Michael? And I just thought
That is
this is
correct.
yep, this is information that he would be interested in potentially as well. So, and a big hi to Robin, who is their teacher for this quarter. So, all right, I will, unless anyone else has anything to say, I'll just let you guys jump into it.
Okay, let me share my screen here.
While you're doing that and setting things up, I think we want to make sure that we give thanks to Molly as well for all of her coordination and all of the fabulous just kind of reports, Molly, that you've brought to keep us up to date on what's going on. As you've already mentioned, incredible staff and Heather and Andrea and others who've been involved, and really thankful to each of the students who've lent their skill and expertise to Project Access Northwest. So,
Thank you.
Yeah, Molly has been wonderful. Well, you all have been wonderful to work with, but yeah, okay, hold on. I think I have it figured out now. Let's see. Okay, here we go. Is that work for everyone?
Yeah.
Okay. Great.
Okay, sorry, Katie, I'm gonna start us off just with some introductions. So we're the APNI DNP students from Seattle University. Katie, I'm Sarah, and then Miguel and Sabina. And we've been with Project Access Northwest for about 8-ish weeks and worked closely with Molly, Andrea, and Heather in some education and learning how to write really solid referrals and getting to know the clients of Project Access Northwest. And so over the course of the 8 weeks, we administered a survey. We learned how to use the translator, which was really beneficial for us in our future practice. And administered a telephone survey, and so Katie's going to go over all of the data from that, and then we're going to each talk about we created a flyer for Project Access Northwest to send out to their clients, and we're going to go over how we kind of came up with the 4 sections of that flyer, and then also show you the results, the flyer, and the policy brief that we created that kind of started off the work for that flyer. But I'll let Katie take over now.
Yeah, thank you. So like Sarah was saying, we each completed a handful of surveys the past 8 weeks, totaling about 77 clients. So I'll go through each question that we asked on the survey. Once we had the data, we inputted it into TrackVia and then came together, put it all together and interpreted it. So feel free to jump in if you have any questions or comments, but the first question that we asked how would you rate the overall quality of care provided by your provider? As you can see, it was overwhelmingly excellent responses, with 52 clients saying they had excellent experiences. Next question was, how comfortable do you feel discussing your concerns with your provider? Again, overwhelmingly very comfortable. How knowledgeable and competent do you feel your provider is in addressing your needs? 56 clients said very knowledgeable and competent. while 18 said knowledgeable and competent. So all very positive. How responsive has your provider been in your needs and concerns? Very responsive, 58 clients, 15 responsive. To what extent do you feel your appointments have helped you address your concerns or issues? 56 clients said significantly helped, and 16 said helped. Have you noticed any improvements in your health since starting these services? Yes, significant improvement by 52 clients. 20 clients reported yes, some improvement, and only 4 said no improvement. This was great. How satisfied are you with your overall experience with Project Access Northwest? And 59 out of 77 clients said they were very satisfied. 10 saying satisfied. There were no negative marks here. Would you recommend Project Access Northwest to someone in need of medical or behavioral health services? So for some reason, as you can see, we got a high no response on this one, but 35 clients said definitely yes. For this client that wrote definitely not, they also wrote a comment, or they made a comment next to, or in response to saying definitely not. And it sounds like I wrote the quote because I think it was important to note that it wasn't a reflection on Project Access Northwest. It sounded like the patient didn't make it to the follow-up appointments, and it was more of a personal preference, not dislike of the program. How would you rate your overall health on a scale of 1 to 10 before starting Project Access Northwest? And then I'll flip to the next slide, which asks how they would rate their overall health on a scale of 1 to 10 after, and you do see improvement. As a group, we were talking about, and to the other 3, jump in if you have anything else to say, but we felt like when I was asking this question, I felt like there was some confusion on, I don't know if there was like a clear understanding of what the question was asking, or maybe like the rating scale. I don't know if anyone else had any other experience with that.
Yeah, I think we just wanted to put a side note with this slide of that in the future, if this survey is continued to be administered, this seemed to be the question that had the most, where I had to repeat the question several times. It seemed to be like relating the 2 questions together. Just seemed to really kind of trip people up when we were talking with them. So I don't know if a written form is better so they can see the difference in the 2 questions. But just for future administration of the survey, these 2 questions seem to be the ones that people had the most difficulty understanding what we were asking in this question.
Yeah.
Got it. That's really good feedback. Thank you.
But you still do see you do see an improvement though in overall health. Okay, and then at the end of the survey, we would ask the clients if they're interested in additional programs. And as you can see, out of those 77 surveyed, an overwhelmingly amount of clients were interested, with Dentist Link being the most popular option. So what clients had to say, Sabina, if you want to.
So here we just have some quotes direct from the clients that you guys can take a look at. And when I spoke to clients on the phone during the surveys, there was just an overwhelmingly positive response. Everyone that I spoke with seemed very happy with their experience with Project Access, and just really thankful and grateful that this was a resource that is available to them.
And I apologize, I don't speak Spanish, so I used Google Translate. So the translations might be a little a little off, but as Sabina said, all overwhelmingly very positive. Yeah. Okay, so our final piece of data, we asked Molly at the end if she could pull data from each of these clients to see how many of these patients had diabetes or pre-diabetes, and out of the 77, 63 of these clients did, which leads us into the next part of the presentation, the policy brief and deliverable.
So we noticed a common thread in many of the referrals was diabetes, regardless of what the referral was for, and that over half of the clients at Project Access have the comorbidity of diabetes. And so we used our weekly discussions as the basis for the policy brief, and for our deliverable, we authored a handout to help educate current clients about how diabetes affects the body in various ways.
So we chose 4 areas to focus on for our flyer. And the first one that we looked at was cardiovascular effects. So looking how diabetes affected your heart. And so just kind of finding the information. When we made our policy brief, and you should be emailed that policy brief from Molly, and then I'll also show it at the end. Our policy brief is where we really dug into this information and looked at evidence-based sources of what is going to affect people the most outside of having their diabetes, and what other areas of their body are going to be affected that they should know. And so people with diabetes are more at risk for heart attacks, strokes, and heart failure. They have dyslipidemia and unhealthy cholesterol levels, and that they also should be aware that there's a link between high blood pressure and insulin resistance. And so having people with diabetes know that taking your blood pressure should be a daily body check that you do, and to make you aware of any changes in that blood pressure are going to signal that you need to seek more help.
Okay, so vision effects and how diabetes can affect your eyes and your vision. So through research, we found that there were 3 different comorbidities that can occur with your eyes. The first one being diabetic retinopathy, which is the leading cause of blindness that occurs in diabetic patients. And it occurs when high blood sugar damages the blood vessels in the retina. So this causes the damaged blood vessels to swell and leak, which leads to blurry vision. So the signs and symptoms are the blurry vision, spots or dark shapes in your vision, trouble seeing colors, dark spots in your vision, and can lead to total vision loss. The second would be the diabetic cataracts. So it's the clouding of the lenses in the eye. But diabetic patients are more likely to get cataracts because high blood sugar causes deposits in the lens, which then leads to cloudy vision. So the signs and symptoms would be cloudy or blurry vision, double vision, light sensitivity. Frequent changes in your vision or prescription could be a sign as well. And then diabetic glaucoma. So I found this interesting that patients with diabetes are twice as likely to develop open-angled glaucoma, which happens when the fluid cannot drain properly, which leads to increased pressure, which then leads to that damage on the optic nerve. So signs and symptoms would be the blurry or hazy vision, seeing spots or dark strings, halos, glowing circles, pain or irritation in the eyes, swelling or puffiness, and nausea.
All right, so moving on to the dental effects. Going back to the data that was collected that Katie talked about, since there's a high percentage of Project Access clients who have diabetes or prediabetes, in addition to one of the most asked resource that clients wanted more information about was Dentist Link. We really wanted to make sure that we included this as part of our project and the information compiled to give to the clients. I personally come from a family that's full of dental professionals, and I spent the last several years working as a dental assistant. So this was right up my alley, and I was really enjoyed putting this information together because dental health and diabetes, they really have a inverse relationship between each other. If one is bad, it will make the other worse, and vice versa. So it's known that those who have diabetes are more likely to have gum disease, bad breath, pain, and tooth loss. And then on the other side of things, those who don't necessarily have a diabetes diagnosis, if they have gum disease, it really increases blood sugar, which could eventually lead to developing type 2 diabetes. But one thing that it's important for clients to understand is that it's never too late to start. It all goes back to those, the things that the dentist tells you every 6 months. Just make sure you're brushing and flossing every day. And especially with those who have diabetes, they need to be checking for swollen gums or any sores in their mouth, because that could be complications from their diabetes or a sign of other serious health problems like oral cancer. And then they also need to be avoiding alcohol-based mouthwashes, and then make sure that they're seeing a dentist regularly, not necessarily when there's a problem, but for that maintenance, which from my experience can be a hard thing to do for a lot of people, especially when they don't have dental insurance. Not many people, from my experience, not many dentists accept Medicaid as a form of payment, Medicaid or Medicare. So finding a dentist that will see you if you don't have insurance, I know is really difficult for a lot of people.
Sorry, I forgot my mic was muted. I'm going to be talking about diabetic neuropathy. And there are 4 different kinds of neuropathy. There's peripheral neuropathy, which is the most common type of diabetic neuropathy. And symptoms begin in the feet and legs and then move on to the hands and arms. Some signs and symptoms are numbness or reduced ability to feel pain or temperature changes, tingling or burning sensations, sharp pains or cramps, muscle weakness, sensitivity to touch, and foot problems such as ulcers, infections, or bone and joint damage. Then there's autonomic neuropathy, which affects the autonomic nervous system. It controls blood pressure, heart rate, sweating, eyes, bladder, and digestive system. And any of these nerves can be affected by this type of neuropathy. And some signs and symptoms are orthostatic hypotension, bowel or bladder problems, hypoglycemia, gastroparesis, sweating more or less than usual, difficulty swallowing, and changes in vision. Then there's proximal neuropathy, which affects the nerves in the legs, hips, buttocks, abdominal or chest areas. And symptoms tend to be localized to one side of the body, but they can spread to another side. And some signs and symptoms are pain in the affected areas, weakness and shrinking in the thigh muscles, difficulty standing up, and chest or abdominal pain. And lastly, there is mononeuropathy, and that's when damage occurs to a single nerve, and this can occur anywhere in the face, trunk, arms, or legs. And some signs and symptoms to look out for are vision changes, unilateral facial paralysis, numbness or tingling in the hands or fingers, foot pain or weakness, and weakness in the hand. And I wanted to talk about foot care because it's a really essential step in managing diabetes due to some of the sensation loss that can happen with neuropathy, if someone gets a cut or something like that, it can quickly turn into infection because someone with neuropathy may not be able to feel it and catch it in time. So the nerve damage can cause changes in the sensation of pain, meaning that the small cut can quickly turn into infection if not caught right away. And diabetes causes blood vessels to narrow and harden, causing poor circulation, which also leads to poor healing. And combined with the reduced sensation, it's important to mitigate the risks of infection with proper foot care. And some foot care tips were washing with warm soapy water and inspecting the feet for cuts, sores, blisters, redness, and applying lotion everywhere except for between the toes. And avoid going barefoot to further prevent injury.
Any questions?
I have a question about the alcohol mouthwash. And well, maybe you know.
Yeah.
Let me.
Like why not to use alcohol-based
Yeah, yeah.
Yeah, so alcohol is known to like dry things out. And so part of the protection of your oral mouth, sorry, part of the protection of your mouth is that you have the saliva, and it acts as that protection to protect the tissue in there. And alcohol-based mouthwashes dry out your mouth and really affect the gums as well. And so that's one of the reasons that it's encouraged not to use alcohol-based mouthwashes, even though those are the ones that feel the best when you use it. You feel nice and clean. It dries out the mucous membrane and leaves you open to contracting more conditions, especially with your gums.
Great, thanks.
This is Scott. I don't have a question, but I do have a comment regarding the scale before and after of how you would rate your health. I wonder if instead of asking those questions back to back, one of the first questions would be how would you rate your health prior to Project Access, and then towards the end, ask that question: how would you rate your health after Project Access, so that it's a little less confusing, and instead of a 1 to 10 scale, something to the effect of much better, better, neutral, similar to the other questions, so that the responses are more uniform and standard across all questions. That might reduce some of the confusion.
Yep, I agree. I agree, Scott. That one was, we learned a lot from this as well, and that one was just a little bit too long, or I don't know. There was a lot of options, and the questions were phrased really similarly. So yeah, I'm not surprised that one was a little bit more confusing.
Hi, everybody.
And then,
oh, sorry.
oh,
Go
I
ahead.
was gonna say, Robin or Molly, if I can share my screen, I can show the policy brief and the deliverable.
Sounds
If
good.
you want me to pop those up on my screen for people to see what we actually produced.
Yeah, that sounds good. And I think Robin had a question
I'll wait till
or a
after you
comment.
share
Okay.
the deliverable.
And I can as well, Sarah, if you want me to.
Okay, let's see. Share. Can people see that? Or do you just see Molly? No? Oh, there.
There we go. Oh, nope, that's just me.
No. It says you're sharing your screen. But are people not seeing the?
No, we don't see.
Okay, Molly, you want to just share it?
Sure, sounds good. The policy brief.
I'll just the policy brief and then the deliverable, the flyer. Yeah.
Okay,
I'll just stop sharing. I don't know why it's not doing it. Okay.
that's okay. Okay, let me just get that up. Oops. All right, so sorry, it's taking forever to open on mine. All right. All right, can you see it?
Yeah.
Okay.
Yeah, so this was the brief that we put together where we really looked at information that was relevant to national statistics and then also King County. So we kind of looked at how diabetes affected us as a country and then really close to home and gleaned a lot of information just from looking at this policy brief. And there's another page if you want to just jump down to that one. So if people are interested in kind of looking at how we came up with the information for the flyer, then it's all in here and all of our references are at the bottom. So if people are interested in like digging into and looking at any of the articles that we looked at, then that is all there for people to see. And then Molly, if you want to pop up the flyer. I think one of the things that I was most excited about with our flyer is we actually, in our group of 4, we had an English speaker, somebody who could speak Spanish, and then somebody who could speak Russian. So we actually were able to provide the flyer in 3 languages to be sent out. And so I thought that was something that I thought was unique to our group to provide that. And with the flyer, one of the things that we really tried to make sure was that the language was accessible to people and then just really give the most basic information that people would know to be aware of continuing to look at other parts of their body and get in touch with a provider or Project Access Northwest if they need help with any of these other comorbidities. Yep. Does anybody else have anything to say about the flyer work that you did?
I just wanted to add, so I was the one that translated it into Spanish, and then I had my wife and my mother-in-law, who's from El Salvador, just look over it just to make sure it was readable and everything. And my father-in-law actually has type 2 diabetes, so as she was reading through it and everything, she was actually surprised about how much they don't know. About type 2 diabetes because he's from Mexico. And so a lot of this, from what we've learned, these are like simple steps that can really be super beneficial for someone to manage everything. But even though it's something so simple, a lot of people, especially in the Spanish speaking community, it's just things that they weren't aware of. So I've already seen that it worked with my this knowledge really worked with my own family. So I just wanted to share that.
Nice.
Yeah,
Nice.
that's great. And then Sabina did the Russian translation. So thank you so much, you
Great.
guys. Yeah, we'll for sure get this out.
Definitely.
All right. Any other comments on that? All right. Well, this was fantastic, you guys. Nice job. I thought you really looked at the data and asked great questions and came up with a really, really awesome handout. Like really nice work. I definitely want to go back through the PowerPoint. If I could get a copy of that, that would be great, and I can send that out as well. To look at the survey data as through what you guys came up with. But that was really that was fantastic. You guys did a great job.
Yeah, nicely done.
Very
Congratulations.
nicely done. Yeah.
Yeah, very nicely done.
Yeah, a huge shout out to all of you at Project Access. I think this has been my first time working with Project Access as in population health clinical. I've learned a lot, and I love policy. I love thinking about social justice and how that's enacted or not enacted at the system level. I think we've learned so much about that. At first, I think it was a little bit intimidating because it seemed like we're not even working with patients, but I think the students really learned that working at the population health level makes very much sustainable change and justice-oriented change. So we also worked on a new project this quarter called iBias, where we learned how to recognize bias in policies and interactions and charting. And I think that was a real, at first it was kind of a stumbling block because it was like, we're not even working with patients. But that became very evident the longer we went on. We had many, many rich discussions about what they were learning. And so I'm absolutely impressed with Project Access and grateful to all of you, and especially to you, Molly, for all your assistance with this. I'd love to work with you again next fall. So huge thank you.
Of course.
Yeah.
Well, yeah.
Robin, I know that we've appreciated the partnership and the work as well. And we're happy to work together to those 4 that are on the line. If you don't want to turn in your computers and just start again after the holiday break with us, I know we'd be happy to take you on. Otherwise, of course, they'll be there on Friday to get laptops from you and have a little just parting gift for you each as well as a small token of our appreciation. But I know that the resources shared today will be shared widely. I know that we'll have some social media strategies around it. I know that we'll want to share it with members of our board of directors and with our program committee as well, and of course with staff who weren't on today's call. So just want you all to rest assured that your work won't just go, if you will, on a shelf and collect dust, but see lots of opportunities for use in at least those kind of areas that I just suggested, but certainly most importantly to the people that we serve and to get resources into the hands of those folks who need and deserve it. So thank you all very much.
Impressive.
right.
Nicely done.
Yeah. Yeah. Very, very nicely done. So, and I make this offer every year, and I'll make it again. If you guys need, letter of recommendation or anything like that, please feel free to reach out. So you guys did a really fantastic job this quarter. So happy to
Great job.
do
Great
that. Should
job.
any? Yep. Yep. All right. Any other questions or comments? And then we can let these folks go and finish out the quarter.
I just want to say thank you so much for having us.
Yeah, it was our pleasure. So I think we're on our
Definitely.
6th or 7th year of this. So it's just been a great experience every year. So
Yeah, every year.
you guys are awesome.
Great.
Yep.
Thanks, Robin.
Thank you.
Or Robin and Molly and
Yeah.
Andrea and Heather, all the people.
It was our pleasure. So yeah. All
Bye
right.
all. Thank you so much.
Bye. Happy
Take
holidays,
care.
whatever you celebrate.
Thank you.
Thanks, guys.
Bye.
Bye.
See you all tonight. Bye.
All the best, guys.